Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Khyati Mehta. Hi, Dr. Mehta. Welcome.
Hi,
And can you introduce yourself to our audience?
sure. Hello, everyone. I'm Khyati Mehta, a practicing pediatric gastroenterologist at Loma Linda University Medical Center in Loma Linda, California. I am board certified in pediatrics and pediatric gastroenterology through the American Board of Pediatrics. I'm also board certified in lifestyle medicine through the American Board of Lifestyle Medicine and have been in practice for over a decade now. I'm so excited to be here to share this journey and my expertise in pediatric gastroenterology with emphasis on nutrition and lifestyle medicine to provide the best care for the children that I take care of with chronic gastrointestinal conditions. So thanks, Shilpi, for having me over. And I would love to, talk about this book and any other questions that you might have.
Well, I'm so excited to have you. As you may or may not know, I probably needed you 20 years ago when I was a teenager suffering from gut issues. Tell us about, we're going to get into your practice a little bit more, but tell us about how you first got introduced to lifestyle medicine and how it's changed your practice of medicine with your patients.
Yeah, so as I think and reflect back to my childhood, I feel like the pillars of good health were ingrained in my childhood. My parents were very active, and my dad is an avid swimmer, and till date, like he's 70 plus, and still swims every day. My mom practices yoga and goes on long walks that I accompanied her as a child. So, it was kind of, we grew up like that. My parents were physicians, and we did a lot of like community outreach, volunteer programs. We organized blood drives. We did a lot of service through Rotary clubs. So social connections was also kind of ingrained in us growing up. And, I've continued to do that as an adult. And while pursuing my advanced training, like residency and fellowship in lifestyle medicine for the last 15 years and putting in over like 80 to 100-hour work weeks, I have made a conscious effort to and push myself, to learn and better health practices in addition to formal training, and to gain experiences, to read a lot of extra books over and above training. And each day I integrate these practices to teach the young minds to learn these better and make a change day after day, and and continue to become better every day. And I truly love this, and this is my passion. And I feel honored and privileged to be entrusted in the care of these children, and so I do take my responsibility very seriously, and I love to help them.
We need you. What is the most common inflammatory gut disease that you see daily in kids?
So, we see a lot of, there is an era now of increasing inflammatory GI conditions, and it is believed to be a combination of diet and environmental stressors that we're all facing compared to our older generations. And like, for example, celiac disease was so infrequent, like even 15 years ago when I trained, and now, we have 3 to 5% of the population with celiac disease being diagnosed every single day. Obesity is so high on the list. We have 30% of America's population is obese, and that is our number one problem in this country right now. And why is it so high? Because we are eating these foods that are high in saturated fats and omega-6 fatty acids, that are laden with sugar. And we're not working as our ancestors or even our grandparents used to work. Like, we use vehicles to take us from the shortest distance, whereas our grandparents used to walk a lot, used to work harder. and exercise daily that we do not have time for because we are always shuttling from one place to the other, taking our kids to activities, forgetting how important it is to walk. So, these are the common GI conditions that I see, and along with several other inflammatory conditions. So I'll name a few, like ulcerative colitis, Crohn's disease. We're seeing more allergies, eosinophilic esophagitis, eosinophilic gastroenteritis. The list is long, but what I can tell you is a lot of these are pro-inflammatory. And as you all can see, diet is a very important and a common factor in all these conditions, in addition to all the medications that we have.
Well, you may or may not know this, but I probably have celiac disease too. I'm just gluten intolerant. But so tell us, how do you treat a patient? I don't want you to do a medical consult on video, but just a quick, like maybe your top 1 or 2 tips on how do you treat a patient with celiac disease with nutrition, other than obviously eliminating gluten. What else do you teach them?
So definitely eliminating gluten, as you mentioned. I go over all the foods that are available that are gluten-free. Because I deal with children, I also have a list of like what candies you can eat and what not, like which Halloween candies are gluten-free, and kids' eyes light up when I talk about that. In addition, I teach them that when you are newly diagnosed with celiac disease and you have damage to your intestine, you could suddenly develop lactose intolerance because your intestinal villi are not absorbing all the nutrients. So you could have this symptom where you're drinking milk and you feel like you now have lactose intolerance. That is very normal, and it does take a few months to resolve after you start a gluten-free diet. So also, a lot of other micronutrient deficiencies can arise when you have celiac disease for the same reason, because of villus damage. And again, it takes a few months to rebuild your intestinal villi while you stay on a gluten-free diet.
You may or may not know this, you probably do, that certain eye diseases are also inflammatory eye diseases. Uveitis is linked to gluten too, and patients with dry eye get worse when they are exposed to gluten too. So everything's connected to the gut. And when you fix what you're doing, you could be fixing so many other problems like throughout the body. Like I mentioned eyes, because I'm an ophthalmologist. What other secondary things do you see improve when you improve a child's gut health?
So that's a great question. And as you mentioned, uveitis. So we have a list of screening that we do every year for our patients with IBD or inflammatory bowel disease. So they get a yearly eye exam, they get a yearly skin exam, they get a yearly rheumatology exam, because as you know, inflammatory bowel disease like ulcerative colitis and Crohn's disease can be associated with joint pains. And once you have a autoimmune condition, your risk of having another autoimmune condition almost increases by 30% compared to the general population. So we have them see the rheumatologist. We don't want to miss rheumatoid arthritis or just Crohn's related inflammatory arthritis, So, and then the skin exam. So, we always, whenever you are on immunomodulators or medications for IBD, we want them to get a yearly eye and skin exam to see if there are any changes in your skin that are going to turn precancerous or cancerous, and we don't want to miss that. So a lot of yearly screens incorporated. And then of course, nutrition, like how can I forget that, right? So we do yearly bone scans in our severe IBD patients. We want to make sure they're not vitamin D deficient, their bones are not suffering because of their chronic condition, they're not losing calcium and becoming osteoporotic. So a lot of these yearly screens that we do.
I know we're getting towards the goal of reversal, but have you seen reversal in your patients when you treat their inflammatory bowel disease of some of these other secondary conditions?
So yes and no. It really depends on the intensity of their inflammatory bowel disease to begin with, and it also depends on the genetic makeup. So we now know, even with obesity, for example, we know that if you have a certain gene in your body, you're going to be at increased risk of, pro-inflammatory conditions that lead from obesity. So you're going to be at increased risk for insulin resistance or metabolic syndrome if you had a certain gene compared to the other person who was obese but didn't have the gene. So yes and no, depending on your genetic makeup.
I love that. I mean, we talk about epigenetics and lifestyle medicine, and that's what you're hinting at, like how our food or our environment or smoking or whatever turns on and turns off some genes that makes us more predisposed. And with your expertise, you can probably help tailor all of that with as a team approach, like you mentioned. That's great. I'm going to shift gears a little bit to our book, How Healers Heal. Thank you so much for being a part of the book. Why do you think other doctors or non-doctors, patients, parents should read this book? And how about your patients, kids as well?
Yeah, so in my opinion, anybody who wants to make the slightest change in their health should read this book, whether it is for good health, nutrition, mindfulness. You know, lifestyle medicine is not just about nutrition, good sleep, exercise, movement. There's so much packed in this book. This book, I haven't read this book in entirety yet, but it is a compilation of physicians and their personal stories and experiences and how their knowledge has helped transform the lives of some of their patients. It's very, very transformative and informative, and I think everybody should read it.
I agree with you 100%. But it shows, like you said, it shows how we're human too, and how we've changed our own lives. I love that. This is such a powerful book. What is your number one takeaway before they read your chapter of making lifestyle changes while they're waiting for their copy of the book in the mail?
So my number one takeaway, I think I'm going to take the liberty to give at least three takeaways here, because it involves like food and nutrition and exercise. So number one would be eat only when you're hungry, eat good food, and eat only until you start feeling satisfied. Do not binge eat or overeat, and always hydrate yourself between meals. I have so many patients who just eat breakfast and then eat dinner and binge eat, and you don't realize it's doing more damage than you think. Eat always small portions and frequent meals at scheduled times. So that's number one about food and hydration. Number two is movement is medicine. So please make that a priority. Please make it a priority to move 20 to 30 minutes, at least 20 to 30 minutes every day, and then more is better. And then number three, I would say is, stay away from negative emotions and negativity. Like always be positive. Always, take even small baby steps to improve your health will go a long way. And people can take away your wealth, your belongings, everything away from you, but nobody can take away your health that you created for yourself. Just like nobody can take away your education, so please remember that nothing is less. Any good step further towards good health is great.
So many pearls that Dr. Mehta just dropped on us. Did you guys write them down? Wow, thank you. Is there anything else you want to mention before we wrap up? And I'm going to put your LinkedIn profile and ways to connect. But anything else you want to share?
Just that, this is my passion. I love helping children. I love if I can make a difference in your life, if you're suffering from a chronic gastrointestinal condition and you want to talk about diet and nutrition. So please feel free to reach out. I can be reached, in person at Loma Linda University GI Clinic or online at khyatipedsgi@gmail for an online consultation. And I'll be very happy to help if I can make a difference. Thank you. And thank you, Dr. Pradhan.
Thank you, Dr. Mehta. Everyone get your copy of the book and read Dr. Khyati Mehta's chapter. Thank you so much.
Thank you. Bye.
Bye.